for group 1, trigger 1 wrap up. So first off, what is functional neurological disorder? It is a neurological condition caused by changes in how the brain networks work together rather than changes in the structure of the brain. And then motivational interviewing and how it helps patients with functional neurological disorder is a conversation-based technique that is patient-centered, decides their goals and desires for treatment, and establishes what their motivation for treatment is. And studies have found that adding a motivational interview portion to a patient's treatment diagnosis or to a patient's treatment plan improved a patient's willingness to participate in their recommended treatments compared to using other techniques.
Another treatment consists of a combination of explaining the diagnosis to the patient, symptomatic intervention, and psychological intervention. So explaining the diagnosis is just in-depth talking to the patient, acknowledging that they now have a diagnosis and explaining the signs that brought them to this point, as well as providing resources for them.
So another part of managing functional neurological disorders or a suggested intervention tactic includes cognitive behavioral therapy due to the decline in cognition. And one of the main parts is just making sure that the patient notices or recognizes some of the difficult thoughts that they might start to experience with this disorder. Some of the methods you can use to handle this include first just talking about some of the anxieties that they're feeling, and then kind of addressing those worst case scenarios and the if it's realistic or not, and then also then planning different ways to handle those situations or kind of navigate some of those anxieties.
Yeah, and then symptomatic treatment really focuses on looking at the symptoms and identifying them, and then creating strategies to help facilitate conversation and to create speech, and taking that from specific examples into more generalized behaviors, and then preparing them for the long term and preparing strategies for when they might go back to what their symptoms are. And this specifically shows up in prosody and intonation in Kate's case, which focuses on the modification of obvious speech, voice, and pragmatic behaviors. And there's also clear evidence of it being really impactful to have either interpersonal relationships or psychodynamic psychotherapy for her in her goals.
All right, and then with all of that, there is a big emphasis on interdisciplinary teams when treating functional neurological disorders. So each of those teams should focus, each individual in those teams should focus on their discipline-specific approaches, but collaboration is very crucial when treating them. Behavioral strategies such as praise for correct behaviors, using planned ignoring of non-functional behaviors, and prediction of positive success should be provided. For example, saying, I know by the end of this month, you are going to be doing this with X amount of success. In addition to discipline-specific approaches, the professionals in the case study were instructed to use these strategies in their treatment.
Within that case study, they were also consulting with a neuro and rehabilitation psychology for the client in that case. It was also shown that support in terms of empathy, validation of frustrations, and co-treatment helped promote patient engagement, and allowing for a period of adjustment to the diagnosis after receiving the diagnosis helped the client become more receptive and engaged in therapy.
And then here are our references.
Beautifully done, everybody.